بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله الطيبين الطاهرين. My talk is about the pathogenesis of this degeneration. Really, my talk is more theoretical, and all the results are from experimental and post-mortem cadaver studies. And it is a review of literature. At a molecular and cellular level, the intervertebral disc has similar constitute to articular cartilage. Chondrocyte-like cells synthesis type 2 collagen, proteoglycan, non-collagenous proteins that collectively form the matrix of the nucleus pulposus and the cartilaginous vertebral integrate. What's about annulus fibrosis? Fibrous-like cell synthesis type 1 and type 2 collagen for the annulus fibrosis. But the constituent of the matrix are not static. They are continually degraded by enzyme, the matrix metalloproteinase, which are secreted by the chondrocyte. What is the benefit? Degradation of the matrix allows it to be refreshed by a newly synthesized component. In normal disc, the chondrocyte subcell a balance between synthesis and degradation of the matrix. Synthesis is promoted by growth factors such as transforming growth factors, basic growth factor, insulin-like growth factors, while degradation is activated by human necrosis factor alpha, interleukin-1, supplemented by superoxide and nitrous oxide. In normal disc synthesis, these growth factors are released if the matrix is degraded in order to promote further synthesis. Tissue inhibitor of metalloproteinase suppress the activation of matrix metalloproteinase, thereby controlling degradation. While degradation cytokines such as interleukin-1, interferon, and human necrosis factor alpha inhibit the synthesis of matrix and promote the production of matrix metalloproteinase. These cytokines are produced by macrophage which enter the disc in response to injury. Macrophage also secrete superoxide which can degrade hyaluronic acid and proteoglycan, causing them to degrade it and can inhibit chondrocyte proliferation and synthesis. In degeneration, this degeneration will occur if the matrix is not normal. At molecular level, will be expressed by the production of abnormal component of the matrix or by increasing the mediator of matrix degradation and matrix metalloproteinase and a reduction in the level of tissue inhibitor metalloproteinase. Meanwhile, increasing concentration of growth factor will reflect attempt to repair the degraded matrix. At macroscopic and microscopic level will become evident in the form of structural changes and defect caused by altered matrix or impaired function of the disc. There are many factors that contribute in the pathogenesis of this degeneration: aging, genetic, nutrition, infection, toxic, neurogenic inflammation, metabolic, and mechanical. All these factors can lead to degeneration of the disc through biochemical reaction. Aging. Changes occur as the disc ages. Individually and collectively, these changes reflect impaired synthesis of the matrix. How? They found that experimentally the concentration of the cell in the disc decline with age, especially in the annulus. The rate of synthesis of proteoglycan decreased as does the concentration of proteoglycan in the nucleus. The proteoglycan produced are smaller, less aggregated because of the decline in linked proteins and type 9 collagen. The concentration of chondroitin sulfate falls, resulting in a rise in the ratio of keratin sulfate to chondroitin sulfate. In chondroitin sulfate الراديكال مالته 2 فهاد 2 atom water, water content, while the creatine sulfate, 1 water content. The collagen content of the nucleus increases and changes from type 2 to type 1, rendering the nucleus more fibrous. The distinction between the nucleus and the annulus becomes less apparent as the two regions coalesce. Non-collagenous protein in the nucleus increase, so water decreased. Increased collagen proteoglycan binding leave fewer polar group of proteoglycan available to bind water. All the result is diminished in the water, decreased in the water. Among the possibilities of aging, what are the causes of this effect? One, declining nutrition, cell synthesis, accumulation of degraded matrix product, and fatigue failure of the nucleus. The accumulated synthesis cell reduce the ability of the disk to replace those lost to necrosis or apoptosis. However, some features of the disk degeneration are not age-related. Narrowing of the intervertebral disk space, tears of the annulus, although all these are the same age, those at the lower lumbar level exhibit degenerative changes, far more often than in the upper level. This indicates mechanical rather than other causes. Genetic factors. Studies in twins have shown a genetic predisposition to this degeneration. A few possible mechanisms have been identified, particularly gene-encoded molecules related to the properties of the extracellular matrix. TAG1 and FOG1 of the vitamin D receptor gene have been implicated in this degeneration in several studies. Polymorphs 5A and 6A allele commonly occurs in the promoter region of the gene that regulate matrix metalloproteinase production. The 5A allele is a possible risk factor for accelerated degenerative changes of the lumbar disc in the elderly, but not in the young. And these are the more important genetic that collagen, cartilage intermediate large protein receptor, estrogen receptor, SOX9, and COX9 encoding. These all are experimental. Nutrition. The intervertebral disc is the largest avascular tissue in the body. Cells in the center of adult lumbar disc are approximately 5 mm away from the nearest blood vessel. Cells in the outer annulus obtain nutrients from blood vessels in the soft tissue around its periphery, and from sparse penetrating capillaries into outermost region. The nucleus and the cells of the inner annulus rely on a more complicated path extending from blood vessels of the vertebral body to a capillary network that penetrates the subchondral plate. Nutrient diffuse from these capillaries across the cartilage end plate and through the dense disc matrix to the cell. Epidemiological and postmortem angiographic studies indicate that insufficient blood supply to the lumbar spine due to erythematous lesion in the abdominal aorta or congenital hypoplasia of the lumbar arteries could be causative factor in this degeneration. A reduced supply of nutrient lead to an increase in oxidative stress markers. Deposition of carboxymethylylysine reflect a distinct cellular reaction to increased oxidative stress and possibly impaired function. A low level of oxygen and acidic pH from the anaerobic metabolism lead a fall in protein and synthesis proteoglycan. A fall in nutrient supply can also reduce the number of viable cells or cause degeneration of the intervertebral disc space. Toxic factors. Nicotine directly inhibits proliferation of these cells and their synthesis of extracellular matters. Smoking is associated with an increased incidence of disc herniation and degeneration, implying a systemic effect by constriction of the arterioles or anoxia to cell in the disc induced by carboxyhemoglobin. Metabolic disorders. Various metabolic disorders can cause this degeneration, either by interfering with the normal biochemistry of matrix synthesis or deposition of foreign material entities. In patients with diabetes mellitus, the nucleus bulbosa demonstrates a significant decrease in hexosamine content, an increase in hydroxyproline, and enhanced activity of enzymes involved in the metabolism of carbohydrate. Patient with alkaptonuria develop intradiscal deposit of a black pigment, inducing this degeneration characterized by calcification, appear as elliptical oblique view. Low-grade infection. It has been proposed that this degeneration could be caused by low-grade infection. One group found that 31% of this harvested after microtesticectomy tested positive for low virulence gram-positive bacteria, and for 84% of these were infected with a Propionibacterium acute. But another study found could not confirm this finding, although 2 of 10 patients they studied exhibit evidence of bacterial infection but not related to acute. Neurological inflammation. Any neurological inflammation that may aggravate this degeneration once a herniated or osteophyte irritate the dorsal root ganglion. Autoimmune therapy. Damage to the end plate after compression injury exposed the antigenic component of the nucleus pulposus to circulation, which may trigger an immune response. This may be responsible for a chronic inflammatory reaction, lead to resorption of the affected disc, or may even involve this at different levels, resulting in multi-level degeneration. And the important factor is the mechanical factor. Circumstantial evidence suggests that possibility of mechanical factor in the etiology of this degeneration. Degeneration is more common and more severe at lower number level. Any abnormal loading condition, including overload and immobilization, can produce tissue trauma and or adaptive changes that may result in this degeneration. Adverse mechanical condition can be due to external forces. They result from impaired neuromuscular control of the paraspinal and abdominal muscle. What is the effect of dehydration? Giving the significant role that water plays in the dissipation of compression force on the disc space. It logically follows that loss of water would lead to significant pathological changes. Indeed, the water content of the disc is nearly 90% in early childhood and decreased to less than 70% by the 8th grade. This decrease in matrix water content may partially be explained by a change in the biochemical composition of the matrix itself. Aging is associated with an increase in the deposition of insoluble collagen within the disc matrix, and this decreases the gelatinous nature of the nucleus pulposus as well as elastic nature of the annulus fibrosus. As the annulus fibrosus becomes less elastic, the frequency of air within it increases. Types of mechanical effect: vibration.
3 minutes only.
Yes, vibration result of animal and in vitro studies suggest that vibration can adversely affect the nutrition and metabolism of the disc, especially of the vibration match the resonance frequency of the lumbar spine. People exposed to whole body vibration in the resonance range, such as helicopter pilot and drivers of truck, buses and tractors, have a high rate of back torsion movement generate tension in the half of the collagen fiber in the annulus, where the other fibers tend to become stuck. For the fibers to include damage, they must be elongated by more than 4% of their resting rate. And this is feasible only when axial rotation at each individual segment exceeds 3 degrees. For this to occur, the zygote of a physical joint must be damaged first and then resist rotation beyond 1.5 to 3 degrees. However, when the spine inflates, the gapping facet joint over less constrained rotation, leading to an annular tear without damage to the facet. Compression. The lumbar disc is designed to sustain compression. Loading is the physiological stimulus for matrix turnover and induced matrix metalloproteinase and nitric acid oxide to clear the matrix in the preparation for new synthesis and reduce matrix synthesis. The most vulnerable component of lumbar disc is the vertebral end plate. When subject to compression, the end plate fail by fracture. This can occur as a result of application of sudden, severe compression, load, as a result of fatigue failure. Subsequently, end plate fracture can precipitate lesion. Now, how are these factors linked? What is their individual importance? Most of these factors are act through different directions. Nutrition will affect aging and then biochemical. Nutrition will affect chemicals. And so from this paragraph you see its effect. And in conclusion, degeneration of the disc has complex multifactorial etiology. Which factor initiate the events in the degeneration cascade is a question that remains unanswered, and most evidence points to an age-related process influenced primarily by mechanical and genetic factors. And thank you.
Thank you very much for the